That's great.
Yeah, I want to say a couple things. I learned so much at both of the courses. I think that Clark and Rick, when he was there, they did an excellent job with talking about a lot of the efficiencies that Tyler and I go over on the podcast a lot, and how to properly structure your team to perform these arches in an efficient manner, so you don't have your patients under anesthesia for 6 to 8 hours. And that's something I get a lot in Denver here. We work with CRNAs a lot who travel around, and they go to the different offices, and there's a lot of general dentists that are doing these cases, and they just aren't doing them in the most efficient manner, and it's causing the patients to be under anesthesia for a really long period of time. It's causing the patients to, when you're in surgery for 6 hours, a lot of times that healing after the fact is really difficult for those patients. And so learning good efficiencies and seeing them done on a cadaver, getting step by step how to do them, it helps a lot with surgery, and it helps a lot for the doctors to continue doing this kind of surgery, because Clark is right that it's hard on your body, and if you're doing a lot of these,